Hi, my name is Kayla Spicer, and today I'll be performing the NG tube placement checkoff. So I'll start by showing you my badge and scanning the room. Okay, to begin, I'm going to assess the patient's order form and check for two identifiers. Mr. Jaguar Jones, date of birth, August 25th, 1963, and he's allergic to penicillin, according to the chart and his armband. I'm going to perform hand hygiene and explain the procedure to my patient. I'm going to gather all of my equipment here. Don my goggles. And perform hand hygiene. Going to raise the bed to a working height, lower the side rails, and provide privacy. I'm going to check the patient's vital signs and bowel sounds. So I'm going to put the pulse oximeter here on the patient's finger. Going to auscultate for bowel sounds. Now, if these signs drop during the procedure, then I will need to stop or pause until they go back to normal. So I'm going to place my patient in high Fowler's position, and I'm going to come up with a cueing sign for my patient if the procedure needs to be stopped. I'm going to open up my packaging, place water-soluble lubricant on here, place the towel under my patient, and prepare my tape. Okay, now I'll get my tape ready. I need 4 pieces, 1 dog ear to measure how far the tube needs to go in. Then I'm going to get a second piece, and this will be the temporary securement. I'll get a third piece for labeling, and then my last piece will be secured to the nose, and I'll need to cut it with my scissors. Okay, now that's folded, it's ready. So I'm going to put on my clean gloves and assess for patency by occluding each nostril and having the patient breathe normally and assessing which one has better patency. Once that's done, I'm going to take my alcohol prep pad and clean the nose and pat that dry. Now I'm going to grab my tubing and lubricate 4 inches here. I'm going to instruct my patient to take slow breaths and relax their head against the pillow while I insert this into the nasopharynx. If the vital signs drop, then I'll stop the procedure. I'm sorry, I forgot to mention that I would have marked this already, but I'm going to do that in a separate video. So I'm just going to place that here for now. Okay, so now that it's in the nasopharynx, I will have my patient sip on some water or dry gulp. And then I'm going to twist it and insert 1 to 2 inches while having my patient relax and flex their head forward. Now, if the patient starts coughing or vital signs drop, then I'll have to remove back into the nasopharynx. Once it's been inserted all the way to the marking, I will temporarily secure to the patient's cheek here. And I'm going to assess with my pen light. Ooh. Okay, and I would also have a tongue blade to press down and just make sure that the tubing is not coiled up in there. Now I'm going to remove this tape and secure it with this one here. And making sure there's enough, there's no tension on there so that the patient can still move their head, and this is according to hospital policy. And now that that has been secured, I'm going to also place the labeling piece up here. And I'm going to loosen my 60 milliliter syringe, but I don't have one in my blue bag, so I'm just gonna have to verbalize this part. And I place it in the clear port here, and I will aspirate for gastric contents, checking the pH and ensuring that this is in the stomach. And I'd also want to have a x-ray to ensure that the placement is correct in the patient. Now, if suctioning is required, then we would connect the suction tubing to this clear port also, and have this above the patient's stomach, have the blue part elevated. And if we were not having suctioning, we would just loop the blue part back onto the clear port here. For this purpose, I'm going to leave the suctioning on, and that'll be up here. Now I'm going to get all of my supplies and clear the area. Remove my, the suctioning will be set to low intermittent suctioning. Then I can remove all the supplies and my gloves and perform hand hygiene. And I'm going to lower the bed, raise 3 side rails, and have my patient no lower than 30 degrees. And I'm going to document the procedure, including the type of tube that we used, where the placement is, which nair, also the time that the procedure occurred, and the patient's reaction, and also the secretions, what color and amount that they were. So that would conclude the insertion of the tubing. And for this portion, I'm going to do remove it. So I would have my goggles off. Now I'm going to check the patient care order form, raise the bed, lower the side rails, and I'm going to don my goggles, perform hand hygiene, and elevate the bed back to the high Fowlers. I'm going to place a towel here and put on my clean gloves. I'd also assess the vital signs, just as I did in the beginning, checking the pulse oximetry and bowel sounds with my stethoscope. Okay, so checking those with my stethoscope. Now I'm going to turn off the suctioning and take the tubing off. I'm going to kink the tubing here and instruct my patient to take a deep breath and hold it for me after I remove the tape. Then I will remove the tubing. And I'm going to place that in the towel here and throw that away. Going to remove my gloves and perform hand hygiene. And I'm going to place the bed back down, raise the side rails, reposition the patient for comfort, and document my findings for the removal of the NG tube. And that concludes my video. Thank you.